Hi, I'm Dr. Jeff Glad, Chief Medical Officer of FullScript, the leading healthcare platform for providers to prescribe healthcare's best supplements, drive better patient outcomes, and scale practice growth with unparalleled efficiency. As a healthcare provider, I know that finding time to stay up to date on the latest trends and research in modern medicine can be a daunting task. That's why I'm excited to share a cutting-edge supplement course our team of medical experts worked on in collaboration with A4M and several industry experts, designed to help you navigate supplements and make more informed clinical decisions. Throughout the 16 hours of content, we'll give you the clinical context you'll need to confidently recommend supplements to your patients. The A4M Supplement Certification course is the perfect starting point or clinical update for optimizing your supplement treatment plans to ensure the best possible outcomes for your patients. Go to www.a4m.com/supplement-certification-course.html and use the promo code podcast20 at checkout to get a 20% discount. Enroll today and elevate your whole person care.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine. I have the pleasure of interviewing Vicki Kobliner. She's a dietitian, nutritionist, and she's actually been doing this for 20 years at least, and knows a lot about what we should be really doing with our kids and how difficult it is to start feeding them the right things, and about looking at the global idea of feeding. So the stage is yours. Go for it, Vicki.
Thanks, Eric. I really appreciate it. And thank you for having me.
My pleasure.
Yeah, I've been working in this field for a long time. I discovered functional medicine and functional nutrition many years ago, both in relation to my own life and family and also the children that I was serving. And what I saw was kids getting sicker and sicker, and they continue to get sicker and sicker. And aside from medication, what we know is that the foundation of life and the foundation of health is always food. And without adequate nutrition, you can never, your body is really like a little biochemistry lab in many ways. And if you don't have the right components, the right ingredients to make all those reactions happen, you can't be healthy. So, and what we're seeing is kids over time becoming increasingly less healthy and also their nutrition becoming increasingly poor. And there are a number of studies that look at that. They look at, are kids meeting their need for certain nutrients, but also certain categories? So for example, there's a pretty substantial percentage of children in this country who don't eat any vegetables whatsoever. On a daily basis, they may not eat one single vegetable. Kids are eating a lot of processed food. They're eating a lot of sugar, added sugar, which is a huge catastrophe. One thing that people don't always realize, there are a number of studies that show that mice, when given the option of sugar or things like cocaine, will choose sugar.
Sure.
So the addictive nature of sugar cannot be minimized. And people don't realize it's so insidious in our food supply, especially in processed foods. So kids are getting sugar in their ketchup. They're getting sugar in if they eat salad, it's also in things like salad dressing. But the sugar is added to so many things. It's really frightening because the amount of sugar they're getting is super inflammatory and leads to chronic diseases.
True, and it's really disturbing because we've been talking about it for maybe 30, 40 years, and everywhere you turn, all you get is more sugar.
Yes.
And so how do you turn around and start stemming the tide in any way possible? So you have to go to the parents who are feeding them, as well as the access to what they eat on their own.
100%. And I start, I often see families, I see women who are pregnant, and I talk to them even at that point about how do you set the stage
So important.
for a healthy baby. And we talk about getting mom's body healthy, helping support her child so that child doesn't have reduces their risk of having a chronic disease later in life. But what mom eats obviously affects what baby eats. And one of the things people aren't aware of is that babies can taste things in utero, believe it or not. And so if mom eats lots of vegetables once she's pregnant, you have a greater chance that your child will actually like and accept vegetables. Same thing is true for breastfeeding. The other thing we know, obviously, is that breastfeeding really is perfect food for babies, but not all babies can be breastfed for a variety of reasons. But choosing the right formula is something I also guide parents about, because there's a lot of added ingredients in certain formulas that are actually not particularly healthy and can be a little frightening at times. So we want to choose the best formula. And then once we start feeding kids solid foods, there are specific foods that actually promote health and other foods that can actually be detrimental. A lot of the little puffed, cereals that we give to our kids when they're, starting to eat solids or in that second year of life are really nothing but processed carbs and really have very little nutritional density, but they're perceived as good baby foods. The truth is that vegetables and fruits are really the right types of foods, and the earlier we expose our kids, the more likely they are to be familiar and accept those foods later. Kids will get pickier sometimes when they're later, but we make them pickier when we assume they don't want those foods early in life. And so getting those foods in is important. The other thing is the quality of the type of food. So what we know is pesticides, the research on pesticides is absolutely extensive and very concerning. Pesticides are implicated in hormone disruption in men and women. They're implicated in changing your gut microbiome, which is that balance of good and bad bacteria. So when your gut microbiome is disrupted, it actually impairs your immune system. It impairs your ability to digest and utilize nutrients, changes your ability to detoxify, and it's actually linked to mood and mental health disorders. So what we see is kids, there's an absolute epidemic of kids with anxiety, depression, and other mood disorders now at very young ages.
True.
And the standard is to medicate.
Right, and that's another huge problem, which is that every kid's on Adderall, and everybody, used to be Ritalin. Then they moved it to Adderall because everybody suffers with ADHD.
Right.
And the question is, how much of that is really food related? How much of that pandemic of disease is food related?
Much of it is food related. Much of it is also gut related, and those two things go hand in hand. You can't separate the two. You cannot unlink them. Healthy diet is going to promote a good gut microbiome, as we know, and that gut microbiome can impact so much of what else is happening in the body. And when we talk about the pesticides, there are links with pesticides and autism, pesticides and ADHD, pesticides and all kinds of changes in gut health. So ideally, we want to move away from foods that contain pesticides. And that can be hard for some, people in the population. Organic food can be more expensive. And we get messages from the government, from various media, marketing agents, etc., that there is no value in organic food. It's not necessarily more nourishing. And the truth is, there are some studies that show that organic food is somewhat more nutritious, but we're not worried about that. It's not about increasing the nutrient density. If you eat an organic versus a non-organic orange, you're still getting the nutrients. What we want to do is stop putting things into the body that shouldn't be in the body. Pesticides are not something the body understands how to process, and they do damage. So what do families do when they don't have unlimited resources? There's something called the Dirty Dozen, which is the list of the most pesticide-laden fruits and vegetables. Those are the ones I recommend if parents can't buy all organic, they choose those organic. There's another group of foods called the Clean 15 that are safer when you don't eat them organic. So if you need to, buy select foods organic as you can, grow them yourself, buy them from a farmer's market. There are ways you can actually get access to healthy food. The other thing that comes up a lot is the toxic nature of much of the protein sources in our diet. The cows, the chickens, the eggs, and how they're factory farmed. And the data on what factory farming does to the animal, and then how that animal's ill health perpetuates itself in us is also very compelling. Again, not everybody can afford a pasture-fed piece of meat. It's very expensive. But you can buy shares in a cow, believe it or not. Get that delivered at a substantially reduced cost. You can, again, use a local farmer's market to find food that's more accessible. And you can also rely less on the more expensive animal protein and start looking at your plant proteins that also provide you with good nourishment.
Yeah, like what examples would you use as far as like vegetable protein for children? Because I know children are much more difficult to feed, as you said, than adults.
They can be more difficult when we perceive that they are not going to like something. One of the things, I'm going to answer your question, but I'm going to also add something else. One of the things we don't do enough with kids is use lots of herbs and spices because we think they like things bland. But herbs and spices are incredibly health-giving. Antimicrobial, they kill germs, they reduce inflammation, they help protect your immune system. They're fabulous, but we tend not to think kids like highly flavored foods. And most of the time, if we give them those foods, then they'll eat a much wider variety because their palate is expanded. When it comes to protein for kids, small amounts of animal protein can be great, good quality. But I also, legumes, beans, kids will eat hummus, kids will eat black bean dip, kids will eat edamame. They often will like that. And then nuts and seeds are another fantastic resource for that. And again, we want to think about getting away from peanuts. Peanuts can often be very genetically modified and contaminated, but almonds and Brazil nuts and cashews and pumpkin seeds, sesame seeds, you can get those as butters. You can make butters. It's actually really simple to make nut butters and very fun, actually. Families, moms and dads can make nut butter with their kids in a food processor, and it's actually the coolest thing to watch because you throw the nuts in there, and first it just gets kind of chunky, then it gets a little crumbly, then all of a sudden the oil spurts out, and it turns into this smooth butter, and it's very cool to watch.
Beautiful.
So it's kind of a fun thing to do. But nuts and seeds, legumes, there are some things like quinoa and some other whole grains are rich in protein. When you provide those, kids will get enough protein, even if they don't want to eat meat. And eggs are another great source, and many kids will eat eggs.
Ask about eggs, right? Eggs, yeah. Will they eat eggs?
Lots
Easy
of kids
to
will
get
eat
them to eat them?
I find a lot of kids will eat eggs. Some of the things we do is we'll scramble them and we'll put them in a wrap sandwich. That's one great way to get kids to eat eggs. The other thing I love, and a lot of kids love, is egg muffins. So again, take the eggs, whip them up, throw some veggies in there. It's another great way to get the veggies in. So saute some spinach or some red pepper or onion, throw it in the raw egg mixture, put it in some baking tins, and bake it, and you'll get little mini muffins, but they're egg muffins.
Sounds great.
Really easy to store in the fridge, grab them in the morning, great for kids to eat it for breakfast instead of some sort of cereal, a processed cereal.
Or something pre-made that you can get, that you're going to get at local Starbucks or something like
Correct.
that. And I think that what you make at home, chances are, is going to be healthier than what you buy that has a shelf life.
Correct. 100% true. Yes.
So
there's study after study shows that typical American diets that rely on processed foods are very inflammatory, are highly correlated with illness in adults and children. And when people eat food that was prepared at home, obesity is lower, inflammation is lower, chronic disease is lower, because there's a couple of pieces of that. We're more mindful about what we put in our recipes. But the other thing is the additives, the things that we need for shelf life, for preservation, etc., are the things that we see are disruptive to our health, to our microbiome. So it's both what you're leaving out of your food by cooking at home and also the increased nutrition that you can put into it.
And I think that you can't stress it enough. I mean, I'm so happy that there are people like you who can help because we need to understand that what we put in is what comes out as far as health.
And speaking of coming out, the other thing that's super important, do you know that there is an epidemic of constipation in children in this country?
No.
Absolutely. Really? It is one of the most common reasons for visits to the pediatrician's office. It's constipation. And the problem is comes from a lack of fiber, comes from a lack of good hydration. Kids don't drink enough fluid, and especially simple water. But the lack of fiber, because there's not enough vegetables, not enough legumes, not enough fruits, etc., most of what they get is very low in fiber. And constipation has all kinds of, aside from the discomfort, it actually, when we poop, we're actually getting rid of toxins in our body.
Of course.
And when the stool stays there for a long time, we actually reabsorb some of those toxins. There is poor gut health is actually correlated with so many other diseases. And when kids can't poop, they're at much more risk of having other diseases. So getting kids to poop is essential, and the two things that we need are water and fiber. Those are two of the biggies, and kids aren't getting enough of either one of those things.
That's sad.
It is. It is.
We've got to change.
Disturbing. Exactly.
Got to change that.
Exactly, but that's an easy fix if you pay attention to it.
Yep. Thank you.
I really enjoyed it.